What's happening, guys? This is Dr. Antonio with Loud Chiropractic and Coaching. Today, we're going to be going over some nuances and some of the information you need to understand about disc injuries, disc bulges, disc herniations, and lower back pain. This does hold true for oftentimes for some conditions within the neck, less common for the mid back, but we're going to go ahead and dive in and teach you a little bit about that. So if you have back pain, then this is going to be applicable for you, especially if you've been told you have a disc injury before. This is also going to be applicable for you. When we're talking about these things, it's not black and white. So we need to understand how certain things respond, how certain body parts move and operate to better understand your injury. And again, the only way that we can really do that is going through a proper evaluation, but this is going to help you immensely. And if you have any questions, follow up. So the disc is what resides in between two of the vertebral bodies. So I have a vertebral body here and here, and then the disc is in the middle. The vertebral bodies have a column, right? You can see the spinal cord goes down the middle of that column. It's protected on the backside by the spinous processes, which is the spine that we can actually feel. And then on the front side, it's going to be those vertebral bodies. And those vertebral bodies stack up really nice like a column. And that column is what gives you that structural support to your spine. Okay. Now the discs in between, one more part I've got in between the two vertebral bodies, then you have these nerve roots that come out. The nerve roots are what then come out to our body, to our trunk, our digestive system, our extremities, so on and so forth. And those will take motor function, signals going out, so telling certain things to do certain things, but then it also brings in information to the spinal cord and up to the brain. So those are very important. We're going to get into some of those nuances here in a moment. But the disc in between, you can kind of think of it as the shock absorbers or the compression component of the spine as it sits in between those two vertebral bodies. Now, it's very, very strong structure. And it can heal, just like any other soft tissue, it can heal. But there's certain things that you need to consider as to why you might be having the disc pain or injury that you have, and how it potentially developed, and what you can do to reduce chances of that in the future. Now, to better understand how the disc is made up, I want you to think of a tree trunk, right? If you look at an old tree trunk, you can see the rings, and the rings give you an indication of how old the tree is. But in our case, the rings, which in comparing it to the disc, is the annulus. So if this is a disc, right, I'm going to have all these layers of rings that go from not all the way to the inside, but they go bigger and bigger and bigger as they go around the outside. Now that's looking at it from the top down. From the side, you can imagine those rings kind of lining up like this, but then the rings will also interchange and be at different angles going across each other. So it really creates this network and matrix of these rings, or these annular rings that come together and can withstand a lot of great compression. It also withstands distraction forces, but then it also helps distract twisting and rotational forces. So any sort of force that goes into the disc, it has this network and fiber of webs that pulls and compresses to make it very strong. Now, what happens is our day-to-day life, we tend to do what we call repetitive movements or repetitive behaviors. So, for instance, if you work at a desk, you're doing a lot of the same positions or movements. If you're doing any sort of weightlifting or CrossFit or HIIT training, or even just working out in general, you commonly are doing the exact same things over and over. And if form, technique, or a number of factors that happen build up, then that same repetitive movement pattern wears on those annular rings, and you can get it what's called an annular tear. And that's kind of the beginning of what leads to disc bulges and disc herniations. Now, depending on the extent of the annular tear, you might not have a bulge or a herniation. You might just be getting the symptoms from the annular tear. If you imagine three different regions of the disc, you have the middle, and then you have these kind of, so if this is the middle, then you have three rings closer, further away, and then the outer. The outer third of the disc is where the actual pain fibers are. So if you have an annular tear without a bulge and you have pain, we do know that annular tear is probably progressing or migrating towards that outer level. Now, how does a bulge or a herniation happen? So let's look at this model here. If Now, this is going to be indicative of kind of an annular tear. So you can see this network ring is holding in the disc. Now, I should mention, I forgot to mention, the inner part of the disc is fluid. So the nucleus, think of like a jelly-filled donut. As you move, that nucleus is going to shift and migrate depending on where the forces are. So if you think of a waterbed, if you push on one side of a waterbed, where does the pressure inside the waterbed go? It goes away from you. So that's really important when we're looking at disc injuries, disc herniations, and bulges, because we want to know where the force is and where the pressure is going. So if I have an annular tear on the outside of this disc here, just doing straight compressive forces, it might be fine. Right, and this could be any sort of just lifting throughout the day or movements. You're going to see this. Just standing, you're going to have compressive forces. We do know from research that the compressive forces within the disc are higher when we're sitting, but then that pressure increases depending on how we're sitting. So if this is the back and this is the front, as I start to flex forward, you see how that pressure pushes backwards. And we have that where that injury was, that annular tear here, depending on the extent of how far that annular tear goes back, you're going to start to see that disc swell into and push through that tear and bulge or bubble the backside of that disc. Now, the extent of that disc can actually push back into the spinal column. What we do not see here are the ligaments that go from the backside of the vertebral bodies that help hold that in. There are missing structures here, but what you can appreciate is that we do have a nerve root here. So depending on how that disc bulge pushes out, it might be bulging enough where it puts pressure on a nerve root. And this is where you might be getting symptoms or sciatica down your leg. You might be feeling numbness or tingling. You might have a little bit of motor weakness or motor loss. And those would all be signs of a true pinched nerve. Oftentimes when people get nervy pain, they're referring to it as a pinched nerve, and that may or may not be the case, but this would be an exact moment of when a pinched nerve would be. Now, what we also need to consider though is when this happens, when your body starts to realize you're getting this, let me turn the angle. When you're getting this bulge happening, and let's say it happened and it's kind of swollen, your body's going to sense this as like an injury. Now it's going to bring a lot of localized inflammation here to help clean up any debris or anything that might have actually happened as a result of the injury, but you get more localized swelling. And that localized swelling might also be putting pressure on that nerve root. So it might be the byproduct of the swelling due to the injury that is actually putting the pressure on the nerve root, or it could be the disc bulge itself. All are important considerations when dealing and rehabbing the injury. Sometimes a steroid pack can reduce that localized inflammation, providing you a lot of symptom relief and opening up a window of opportunity for you to do rehab care and movements that help supplement it if you're having a little bit of trouble gaining traction. Now, there are certain exercises though that help with this. So one of the main ones is called McKenzie extension exercises. So if we have this bulge here, notice pressure in the front side push the bulge backwards. So if we put pressure on the back side by going through extension, we're actually going to be pushing pressure into the disc this way, helping reduce that bulge or herniation that was developed by the postures and the positions that we were doing. So this is why McKenzie extensions, we use a lot of hip drops in our offices. And if you don't know these exercises, reach out and we'd love to be able to provide some resources that show that, can also help. Now, the other thing that we need to consider though is also how you're moving throughout the day. So let's say for instance you're unloading the dishwasher. So if I'm loading the dishwasher and I'm not hinging through my hip joint, and I might be actually adding more flexion here, and then I might be adding more pressure and bulging onto that disc. So if we're being super mindful about how we're moving, but then we do something a little bit more careless by flexing forward, it's like having imagine having a cut on your knuckle and you're trying to let it heal, but then you go to grab something, that scab then cracks because it's right at that flex point. And so it makes it very hard to heal that injury when it keeps moving. So this might be a time when we actually might need to put a splint on our finger to not allow it to move and bend so that that scab can heal. The same holds true for this disc bulge or herniation. That annular tear it takes a little bit longer just due to the nature of the blood flow and nutrient supplies that it gets, but it can heal like other soft tissue injuries. if you let it. What commonly happens when most people go through lower back injuries, disc herniations, and bulges, they're not talking about the preventative side other than just rest and don't do anything. They're talking, they might be talking about maybe doing some exercises, but they're really just saying, just let it heal, rest, and don't do anything. But what most people don't realize is the positions are the things that they're doing on a daily basis, activities of daily living, unloading the dishwasher, picking up a bag of dog food, leaning over to wash your face or brush your teeth are all opportunities in which you can help the healing process or actually hurt the healing process by scratching at that scab that's trying to heal and constantly flexing forward. So what do we mean by hip hinging? So I'm going to grab this other model here. So this is your hip joint. It's a big ball. It's a big greasy ball and socket joint. It's really good at offering movement. The spine, on the other hand, it can move and it is really good at flexing, but it depends on the load and the context and the task at hand. So when we're talking about picking something up heavy and or if we're talking about bending forward and reducing load on the disc, we need to hinge better through the hip. So notice as I do that, the spine actually isn't flexing and bending all that much. It's pivoting around the hip and it's just, or pivoting around the ball and socket of the hip, allowing the back to remain straight. So this is a prime opportunity which allows you to keep doing all the things that you need to do, especially if you're a parent or if you have a very, very busy active lifestyle, or some of the activities that you just enjoy doing, such as gardening or anything else. Maybe it's working out, but it allows you to stay active and keep doing things and not keep irritating the disc injury that we're trying to be protective of. So that's critical. That is one of the most critical things that we talk about when trying to get over disc bulges and herniations and disc injuries is stop pissing it off. And the way you got into this mess is commonly how you get out of it. So if we're talking about poor movement mechanics from exercising or lifting a potting soil or a big pot, then you need to be mindful about those things so that you can let the disc heal and stay active, but then also knowing that that is what you need to work on and get better at in the future so that we don't keep pissing things off. Now, like we already indicated, these things do heal and they just need a little bit more time and effort. And most of us, we just keep irritating things. And that's why we get super frustrated. It's like, it's been a couple months. I'm not seeing any progress or things are getting worse. We're just forgetting that we have to be mindful of those movements and those patterns. Now, again, highlighting that let me try to be succinct here. So highlighting that what we need to do is be mindful of that, but you're going to see this from time to time. We cannot avoid this completely, but this is also very powerful information because if you do get that little bit of pain, that is indicating that the movements or the activities you're doing are causing too much disc loading and disc pressure, which might be preventing your progress. So that's going to be a huge thing. We've already talked about the extension. The extension helps us reduce any sort of additional pressure on the backside of that nerve swelling or pressure. And those are all important because we don't want that to keep just bulging and having more and more pressure. Now, the last thing that we didn't talk about, we don't see any muscles on this model here, but what we have to consider is oftentimes a lot of the pain that you're experiencing is the muscle guarding and tension that comes as a byproduct and a symptom to what we're talking about here. It is very rare that you'll actually strain a big, thick, hardy muscle such as a paraspinal or a QL and doing a lot of the movements that trigger or exacerbate lower back pain. It is possible. We're not saying that that is not the case, but what we commonly see is that it's more of a byproduct in the guarding process of protecting very sensitive structures such as the nerves or the disc. When you start doing a lot of activities or repetitive movement patterns that constantly irritate those structures that are very sensitive, your body's gonna say, oh, this does not feel good. I need to lock it up and protect it so that things don't get worse. And then you get a lot of lower back tension or tightness or spasms or guarding. Now, imagine if I asked you to hold your bicep and squeeze it really tight. How would that bicep feel after a couple minutes? after a couple hours, after a couple days, or even a couple weeks. It's going to start burning and it's going to hurt because it's constantly in a contracted state. When muscles are contracted, that also squeezes the arteries and vessels that need to go through and supply it with nutrients, oxygen, so on and so forth. So it starts to burn even more because it's in a hypoxic state and it's not getting the actual nutrients and oxygen that it needs. So we need to find opportunities that allow the muscles that are guarding and protecting, and rightfully so, we need to find opportunities that allow them to calm down and relax to help that healing process. The more that those can calm down and relax, the more you're able to move, the more you're able to move, the more you're able to get more of that blood flow in, the more you're able to realize that certain movements are actually feeling good. And what we call this is a feed forward mechanism or a snowballing effect. If we can get you rolling in the right direction and get some momentum, then commonly you're going to keep that momentum and you're going to keep following forward in a good way. The same is also true though when you start irritating it. If we're not being conscious about the movements that irritate it or cause more pressure on the disc, then you start having a negative feedback loop. The more pain you experience, the more pain you're going to experience, and then the more pain you're going to be in, and then you're going to become more sensitized, and that any tiny little movement or anything out of the norm is going to set you off and trigger. So this is very common for a lot of chronic pain individuals where they just see this balancing. I'm good for a little bit, but then I get really bad. And then I get a little good because I don't do anything, and then I get really bad. And they're constantly in this flip-flop type of mode of too hot, too cold, too hot, too cold. And what we really need to find and dive down are what are really the movements and the things that irritate it. It's going to be different for everybody. So we need to find the opportunities for you that allow you to move and keep moving, and talking about the ways we can work on muscle tension, talking about the ways that we can work on how you can move better, talking about the ways that you need to potentially consider doing your exercise classes or your training or working out at a gym. Those are all really important pieces of the puzzle. But it's got to be kind of selective tailored because it's going to be different for everybody. We do see a theme though when you're talking about disc herniations and bulges. For a lot of people, it's that bending forward and flexing forward that tends to trigger them the most. So we have a couple starting points that work really well for those cases. If you have nerve pain or signals or symptoms, these can also help with those. So don't just assume it needs to be drugs or surgery. Movements and decompression are also very, very valuable. You just need to know the right exercises to do. So I hope this was helpful. If you are suffering from disc injury, if you've been told you've had a disc herniation or bulge before, do not write this off as a death sentence. There are a lot of things that you can do. The disc can reabsorb and it can heal itself. And even if it doesn't do that completely, you still have opportunities in which you can do certain exercises and movements and continue to strengthen your core and continue to strengthen your hips. That can all help stabilize and make the back stronger and more robust, which might have been the reason it happened in the first place. So if you have experienced this before, you know how tough it is. I hope this was super helpful for not only your confidence maybe right now, but also your confidence in the future. If you've ever had a recurrent back pain episode, or you kind of know how you go through this cycle of on and off, but more importantly, if you know of someone who's dealing with this stuff, like please share this information with them. These are a lot of things that are not being talked by medical providers, orthopedics, physiatrists, and even physical therapists. We're sweeping under the rug, trying to assume that just if the basics don't work, then it's too complex and nothing can help. There's a lot of things that can help. You just need to understand how the discs work and ask the right questions to figure out what is the right path for you to help you get on with your life so that you can live the adventurous life that you're made for. Once again, my name is Dr. Antonio with Live Loud Chiropractic and Coaching. Thank you for tuning in. Please reach out to us if you have any questions. We would love to serve and help you. Live loud, guys.